Hello, my name is Yskert von Kodolitsch. I will present you a pill of knowledge on the 7 signs of Marfan syndrome. What is this good for? If you are among those people who wonder if they could have a Marfan syndrome, these 7 signs may be a help to find out. First, I will explain what is the Marfan syndrome. Marfan syndrome is a rare disease with autosomal dominant inheritance. Marfan can cause lethal rupture of the main artery, which is the aorta. And Marfan can also lead to heart failure, blindness, and skeletal problems. Medical care in specialized centers today can prevent or mitigate complications of Marfan syndrome. So those with a Marfan syndrome should definitely find a center for care. So for Marfan care, it is important to have an early diagnosis to protect you against complications. If a Marfan diagnosis is not established, the 7 signs that we will talk about in the next couple of minutes may help you to estimate your personal probability of having a Marfan syndrome. The presence of these signs may warrant a definitive diagnostic workup for Marfan syndrome. So this is the first sign of Marfan syndrome. We call it the sump sign. The sump sign you can see in the upper panel of the picture. You can check it the following way. Does the entire nail of your thumb project beyond the ulnar border of your hand when you clench your hand without assistance? If yes, the thumb sign is positive. Second, the wrist sign in the lower panel of the picture. Does the thumb overlap the terminal phalanx of your 5th digit when you grasp your contralateral wrist? If yes, the wrist sign is positive. If the thumb and the wrist sign are positive, both on both of your arms, then you have 1 point for a Marfan sign. The second sign of Marfan syndrome is a funnel chest or a pigeon chest. A funnel chest is also called pectus excavatum. Does your chest have a caved-in or sunken-in appearance? If yes, you have 1 point. A pigeon chest or a pectus carinatum. Does your sternum protrude and stick out more than usual at the front? If yes, you have 1 point. The third sign of Marfan syndrome are stretch marks. Stretch marks are also called striae atrophicae or striae distensae. Do you have stretch marks that do not result from pronounced weight changes or pregnancy? Are these stretch marks at atypical sites, such as the mid-back, lumbar region, the upper arm, axillary region, or in the tights? If yes, this is very typical of Marfan syndrome, and you have 1 point. The fourth sign of Marfan syndrome is surgery for the thoracic aorta. Did you undergo surgery of the thoracic aorta? If you underwent such operation, you may still have a scar in the middle of your breastbone. So if you underwent such surgery, you have 1 other point for Marfan syndrome. The fifth sign of Marfan syndrome is a previous pneumothorax. A pneumothorax is a collapsed lung. Did you have an abnormal collection of air in the pleural space between the lung and the chest wall? Did you stay in hospital for a couple of days with a chest tube or intercostal drain with pressure suction? If so, you have 1 other point for previous pneumothorax. The sixth sign of Marfan syndrome is a family with Marfan syndrome. Does someone in your blood kinship have a firm diagnosis of Marfan syndrome? If so, you have 2 points for Marfan. Finally, Ectopia lentis is a highly suggestive sign of Marfan syndrome. Ectopia lentis is also called dislocated lenses, lens luxation, or lens subluxation. Do you wear glasses for refractive correction? Do you undergo or did you undergo eye surgery with lensectomy with implantation of an artificial intraocular lens, IOL, or with contact lenses? This may be suggestive of ectopia lentis. If you have ectopia lentis, you have 4 points in the score for Marfan syndrome. For the results of the score, you need to sum up your points from the 7 signs. Your probability of having Marfan syndrome is 14% with 1 point, 57% with 2 or 3 points, and 91% with 4 or more points. If you have some points for Marfan, you may consider meeting a Marfan specialist. The more points you have, the more useful it may be to present to a Marfan specialist to rule in or to rule out Marfan syndrome. Want more information. If you want more information on the scientific foundation of the 7-sign score, there's a publication that you can check on. If you want more information on clinical signs of Marfan syndrome, there's another link where you can have further information. We hope that this. Thank you for listening. Bye bye.